today we're gonna talk about heat. So I hope I hope none of you come here because you already have a heat pain. Preventive, it's better than cure, okay? but I have to say, any one of you who has a heat issue, I hope this will help you as well, okay? Or your loved ones. Okay, so some disclaimer, okay? And if anyone is curious about what else I do, you can scan this QR code. It's all my credentials on LinkedIn, okay? Now, this is roughly what we're going to talk about today. We're going to talk about our body and what can happen when we grow old, and what are some of the common operations that is being done, and therefore for some patients or some family or friends that you know may have something called heat replacement, then they need to observe some heat precaution. What's that, right? And then we're going to talk about, okay, so what, right? After injury, after repair, how we're going to move around. And then I'm going to share with you some tools that's available in the market, and what we can do to help other people once we have gotten better. Okay, so first thing first, let's learn more about our body, right? Any part of it can go wrong. I know this sounds a bit depressing, but don't worry. That's why we're doing this talk, right? Okay, so first thing first, let's go from the innermost to the outermost, okay? Now, if you take a look at the image on the right side, you'll see that is our skeleton, that's our bones, right? So bones can either break, okay, or get fractured, right? We commonly say it's fracture. Now, if you look at the labrum, it's just, it can tear, it can wear and tear. And if you take a look a little bit more, there is ligaments, and ligaments can get stretched out, it may tear, okay? And we also talk about, let's move on to the picture on the left-hand side. Okay, so after the bones, after the ligaments, after the cartilage, after the labrum, we have something like a thick white band, right? That something that looks like spider web. That is also a ligament. So ligament presents very differently in different parts of the body, but in general, if they get too stretched out, it's called a sprain. And then if it's too stretched out and you put more strain on it, it will tear, right? So after that, you can see, what's all those yellow color streaks coming out? Make a guess. What do you think that is? If you're new to my talks, right, I like everybody to unmute yourself, show your face, and we have interaction. So make a guess. What do you think those yellow color stuff is? I kind of can sense this.
Nerve, is it? Nerve.
Yes, well done. Correct. Those are the nerves, right? So if you look carefully where the nerve comes out, if the bone area around that place is fractured, it will also cause you nerve pain, which will represent like numbness, pins and needle down your leg, because the nerve that comes out from our hip region supplies the hip, knee, ankle, and foot area. So you may feel anywhere that is slightly off, sensation off. But nerve also does another thing. So other than sensory, there's motor function. So all those parts that I just say, you may feel weaker, okay? And you see that the thickest, can you try to find the thickest yellow nerve? That, ladies and gentlemen, is called a sciatic nerve. And this is the one that causes you something like sciatica. Okay, so a lot of times it's the nerve that is affected, okay, and it spreads all the way down to your legs. Okay, now if you take a look closer, there is a yellow streak that's coming next to the nerve. Make a guess. What are they?
Blood vessels?
Yes, well done. Thank you so much for that. Okay, so we learn, okay, there's also a lot of blood vessels going on, right? So your blood vessel may rupture, it may not grow as well, And really anything can go wrong, right? Now, if we look closer, right, there's something like the muscles, right? All those pinkish with streaks. Okay, those are the muscles. Now, muscles can either be weak, it can be strained, it can be too tight. Okay, and if you take a look closer, if your muscles are very tight, what happens to the nerves and the artery beneath? What do you think can happen?
Blood supply?
Yeah, precisely. Well said. All right. So if your muscles are too tight, it will strangle all your blood vessels and your nerves. And if it strangles your blood vessels and your nerves at the hip, what do you think will happen to your knee and your ankle? Will they be affected? Yes or no?
Yes.
Yeah, precisely. So even though, sometimes you say, yeah, you got an ankle issue, but sometimes we have to check further up. It's just like today, PIE is jammed up, but a lot of times it's not the area that has the incident. The incident may be somewhere further up. Make sense? Right? So this is exactly what happens in our body. All right. Now, let's take a closer look. This is the front view of your hip. Okay, so everybody take your palm and put on your right groin. Okay, this photo shows the right side where your palm is right now. Okay, now a lot of times, do you see this red color artery? It goes around your hip. Okay, now for some people, for don't know what reason, this blood vessel may be injured. Now when it's injured, it cuts off the supply altogether. What do you think will happen to the bone there? Do you think it's gonna be healthy or unhealthy?
Unhealthy.
Yeah, precisely. Right? So it's like, wow, today you don't feed me, right? Auntie Shan cannot talk already. Right? PT Shan cannot talk already. Unhealthy, right? That's why it's so round. Okay, so you see, if let's say this head of femur, which is your thigh bone, right? The official name of your thigh bone is called femur. So the head of femur sits right where your palm is, right? I can hear your camera. Oh, thank you so much. Okay, so if this head of femur dies off, right, when you stand up, you cannot weight bear on it because the force cannot be transmitted because this head will start to shrink and we call it necrosis, right? It dies off, right? So when this kind of thing happens, right, we need intervention, right? Okay, so there's two common intervention. Okay, the first one is called a hip replacement. Okay, if you take a look at series number 1, what happens is this: they will shave off whatever is damaged. Just like today, we will shave off the damaged strawberry. Correct enough? Right? Only one side kopak, right? Then you cut off where it's injured. Then in step number 2, they will put on a metal or plastic cap. Okay, to replace where they have cut. Then they will put them together and they will stick it back up into your joint space, which you see in number 4. So it's like a overhaul. This is one of a few things when nature takes its course, you can still do something about it. Like you are brand new, brand new. Okay, so this is the hip replacement. So if it's both your pelvis area and your femur area that is replaced, it's called total hip replacement. If it's just one or the other, it is called impartial. Okay, partial hip replacement. Sorry. And the other operation that is commonly done, especially when old people, they fall down and they fracture the neck of their femur. So the neck of the femur is slightly just below the head, right? The head is the round a golf ball, and then the neck is somewhere along that red color line that you see over there, very near there, yeah? Now, this is called a dynamic hip screw. It is not so bad, but also it really depends how bad is the fracture. If it's something that you can still patch back, they can use screws and plates to hold it in place. But if it's like, wow, chui, like powder, that one cannot lah, huh? You cannot really salvage, right? So that's where the hip replacement comes in. But it really depends. As a therapist, I got many people with dementia, and they cannot remember. They cannot remember, after hip replacement, need to observe hip precaution. And this is where the hip screw comes in very nicely. Why? The hip screw, right, after it's done, you can do things as per normal. So for my patient with dementia, they cannot remember, right? This is one of the better ones. Okay, and it's also less blood loss, because you don't need cut here, cut there, cut everywhere, right? The butcher, right? Okay, so we tackle the bigger problem here, right? A lot of people got hip replacement. Wow, as good as new, but it doesn't come without a price, other than the titanium lah. Okay, so in Singapore, a lot of doctors, right, they usually like to cut from the backside. Okay, so that where you see the circle, okay, that's usually the posterior incision that we always talk about. It's always at the buttock. But this way, right, got some problem. If today you look at the picture on the right side, okay, these are the hip precautions. Let me bring you through. The first one, where you see me cross my leg to read a book. Number one, you cannot cross that injured side, the operated side, cross midline. Okay, remember this, because later on, whatever we do, right, it revolves around these 3 hip precautions. Okay, so number one, do not cross over the midline. Number 2, you cannot turn the foot inwards. Okay, so in the picture is the leg on the left side that looks like an L shape. Okay. Number 3, very important, you cannot flex your hip so much so that the angle is smaller than 90 degrees. Okay. So if you take a look at the green, the picture on the bottom left, that is the correct one. Okay. So the angle is around your hip joint. Okay. If you're confused by now, you should, because later on we're gonna be clearer. Okay. So just remember, we cannot flex too much. We cannot bend too much. We cannot cross too much. We cannot turn in too much. Why? Because all these forces will break open that scar at the posterior incision. And then what will happen? If your hip is not healed yet, and you put so much stress on it, your wound will break apart and there will be a joint dislocation. Right? So let's talk about, you have a operation done. Okay, now we're going to talk about how we're going to move about in daily life. First thing first, sleep. I love to sleep, by the way. I sleep at 9:30. Yeah, I know. I'm only 32. But yes, sleep is very important to me. Okay, this is where I meet my boyfriend every day. Okay, so sleep. Everybody, let's have a discussion here. You see, if I sleep sideways, my leg will cross midline, right? So let's think about, okay, what can we do to prevent that? Anyone? No right, no wrong, creativity rules. Make a guess. What do you think you can do to keep that leg open?
Support with pillow.
Very good. 1 or 2?
In between the legs also.
Correct. Right. So a lot of times, people ask me, hey, I put pillow. Yes. I put pillow already, but then I also don't know how much is enough. Put 1 or put 2, right? So people always ask me this question. So my answer to the person is this. Whatever pillow you use, it must be thick enough to separate your leg so that your leg don't cross the midline. Okay, Okay, good. Now, next one. We're going to watch some videos, okay? Oh, by the way, all these videos, right, are found on YouTube that you will be able to see them after this, okay? So no worries. Okay, it will be found on the Golden Concept channel and my channel. Hey. Okay, so that kind of like answer a lot of question of, I operate on my left side. Where can I come out from the bed? Usually, right? In the hospital, the therapists were being told to get the patient out from the better side. But as a home therapist, I realized that, some people's house are just structured in a way that they cannot come out from the other side. Sometimes it may be because of furniture, cupboard, and whatnot. They just can't get out from that side, and they don't want to change the way they sleep. They don't want to change the other side because of maybe some people believe in feng shui. Right? So this is where I get bopian, right? So as a therapist, I need to start thinking about ways. So those methods that you saw just now are actually some of the tested and proven methods with my elders. Now you may be surprised. You'll be asking, hey, sure no, my mother 90-year-old can do what is being shown in the video. No? I tell you something, okay? Those methods that you just saw was generated by my 90-plus-year-old ama who had a hip replacement, right? So she very happy, She tell me, hey, I tell you, when I was in the hospital, I exercised 2 hours a day, 2 hours. I was in the hospital for 1 month. Wow, you know how much I exercise, Then I asked her, so what are you exercising with now? Like, how are you exercising, right? She said, no, I don't exercise. I said, why not? She said, oh, because I can't even get out of bed. I was like, what? So it's because in a hospital, okay, let me explain. In a hospital, there's a hospital bed. When she went home, she didn't want a hospital bed, never mind. So she sleep on a wooden bed, right? Cannot adjust for. Then she's like, I have to wait until my son comes back, then I can sit down a bit. Then I was like, alamak. So that's the reason why we come up with the idea of, okay, we tie 2 towels together and then we tie it to the window grill so that she can pull herself. Rock climbing. Yeah, I got my ama to actually do rock climbing. So if you don't want that to happen for your ama, you can use the caddy that you saw in the video just now, okay? Okay, so after you get up from bed, right, you need to be able to stand before you can go on to walk, right? Okay, so let's watch this video. Looks not that difficult, right? Okay, now something that is more difficult maybe dressing. Okay, so upper body, we don't talk about upper body dressing because nothing wrong with the hand. So today we're gonna focus on this lower body dressing. We're gonna tackle the hardest one, which is long pants. Okay, so but for some of you, if you think that you're not very sure, maybe you can start with shorts or maybe like a dress or even a sarong, as just wrap around. That's possible as well. So we are tackling the most difficult one. So if you can do this, anything else is easy like a breeze, okay? I have to say, there is no one right way of doing things. And this is because everybody's body type is different. Your preferences of your clothing is different. So there is really no right, no wrong of how we do things. The most important thing is this. You need to understand the underlying principle of first of all, your condition, and whatever intervention is in place, you need to know, okay, what is the basic principle? So in this case, we're talking about the 3 heat precaution. So as long as you know your own condition and whatever intervention it means that you have to take note of, there is no right, no wrong method of doing things, right? So this is where, as a home therapist, I will always brainstorm with my patients. Yeah, I tell you that there's no one right answer, okay? And these methods that you see is actually some methods that we kind of experiment together, okay? And also because if you take a look, as time goes by, we get access to a lot of e-commerce products, right? This is where, hey, you know what? Some people actually think of something, and this is where we start to experiment. Okay, remember that pants that you saw just now with the zip? I tell you, I've never seen it before until I go and find Vanessa. I was like, whoa, got such thing. I thought that's Velcro only, No, this one entire pants can open, I was like, wow. So yes, okay, so we always be open to suggestion because you never know, sometimes certain method is better. Especially like for me right now, I'm doing palliative care. I see people who are dying, end of life, and they really cannot walk already, they cannot even move at all. So a lot of times we just have to tweak a little bit of our expectation and change the way that we do things, right? You find that in life, things will be so much smoother, less frustrating also. Okay, so are you ready? This is my second home in the house. The toilet. Okay, at this juncture, I want to pause for a while. Now, for those of you who have a knee problem and you cannot, so for some reason, you cannot bend your knees as much, this method will work as well. Not just for hip, okay? Okay, so at this juncture, I want to introduce you to a horror story because it's Halloween. No, I'm just kidding. Okay, so for those of you who have heard of this before, you bear with me again, okay? But for those of us who are not, who are new to my talks, I just want to highlight to you that elders' skin is like paper skin. For you and I, if we just scratch ourselves, all you see is a red streak, and you won't see anything much. But if you do the same thing to a 90-year-old with paper skin or anyone with skin condition, just that one scratch will cause their skin to break open and bleed. Okay, it will cause bruise. So that's one of the reasons why we're showing this scene. Okay, so that's that. So that's that for the videos, questions, because we're coming to the Q&A soon. Okay, now I'm just gonna quiz everybody, okay? Okay, so this is where you unmute yourself and try, okay? Try. I don't know whether I got prize or not. Okay, so remember the 3 heat precautions. What are they? Okay, I see some of you muttering. I can somehow read your mind a little bit.
Not cross the legs.
Well said. Okay, that's one. What's the other one?
Not too much extension.
Extension.
Is it
Flexion.
extension?
Flexion.
Flexion.
Yes.
Yeah.
Extension means you straighten. Yes. Very good. Very good. Okay. The third one you don't see much. But what can you not do?
Do not roll ankle inwards.
I say
yes.
if I'm the teacher of this class, I'll give everybody an A. Well said. Wow, within the last 40 minutes, you retain the most important thing already. Okay. So now we're gonna go into a bit of troubleshooting. Okay. And let's say everybody, you take your palm, left palm, put on your left hip. Okay. This is the hip that has gone through operation. Today, we're going for an outing on a car ride. Now, where will you sit? Will you sit next to the driver or will you sit behind the driver? Now let's see the race.
Behind the driver. That's
behind the driver, no space. Behind the other seat.
Next to the driver.
Okay, so some people say, hey, behind no space. But some people say, hey, behind also can what? If the driver's more
move the seat, move the front seat forward. That's what my husband does.
Good, very good. Okay, so for those of you who say on right beside the driver, you are right. Okay, this is the seat that can always move. If suddenly extra space comes in. Okay, so not just that. But the question is this, why is it so important for that space? Right? Because if you have enough space, do you have to bend more or bend less at the hip?
Bend less.
Correct. Which leg goes in first?
The right.
Correct. If your right leg go in first, can your left leg cross the midline?
No.
No way. No way, right? Okay, so very good. So question now is this. If you have a right side total hip replacement, where should you sit? Beside the driver or behind the driver?
Behind the driver.
Very good. All of you are 天才耶. Okay, so I'm going to show you some, okay, of the coolest tool ever. That is $100 note, by the way. So that's called a long handle reacher. Okay. Now, the one on the right side, okay, my ama tell me, hey, I home alone leh. Who gonna wear shoe for me if I cannot bend over, right? So that red color stick, it's called a shoe horn. A shoe horn. Okay, and both these items are very cheap. You know, you can get it at $1 to $2. From Daiso. But remember, must be long enough. You get those short one, no use one, This one must be very kiasu lah, Okay, now, with every hip operation, usually it lasts, the hip precaution you have to monitor for 6 months. Okay, 6 months. So it's not like, wow, the whole of your life, you cannot bend your hip, you know. Even you find $1,000 note, you cannot pick it up, you know. No, okay. Usually 6 months, but it really depends on the confidence level of your surgeon. For some surgeon, when they operated, they will think, you know, it's better not to risk for certain reason. Then you follow your doctor's advice in general. Okay, but when I was working in a community hospital, the visiting consultant would tell us 6 months. Okay, now when you recover, and you will recover, that's why you do therapy. You can please don't throw away all your equipment, because there are a lot of people who needs them, who cannot afford them. So these are the 3 websites that you can visit to either donate or sell at cheap cost or whatnot. Now, people who is towards end of life, they have a senior mobility fund, but they cannot use it because there is one clause that asks the therapist whether this person will need this equipment for more than 3 months. And a lot of times they won't be able to survive that long. So if you have a lot of equipment like hospital bed, commode chair and whatnot, like walking aid or even shoehorn and whatnot, or those pens that you will benefit other people, you can actually donate to all these organizations that is on the right side. Okay. Now it's time for Q&A. Q&A. All right. So Q&A. Any questions? I love questions, by the way. Any questions? I love questions. Is there any in the chat?
How to prevent hip from replacing? What are the steps? I mean, like before it can happen now.
Oh, very good question, Alex. Okay, a lot of times for the old, okay, I'm going to move from the old to the middle old to the young old. Okay, so old is above 18. Okay, so above 80, usually what causes a hip to fracture and therefore a replacement is a fall. Okay, so prevent fall is very important. Like if the person need like walking aid to help them to walk better, okay, you can do that. But for old people, a lot of times it's neglected is the diet. The diet must be filled with protein because no protein, no muscle. No muscle, no power. Make sense? So all of you here, hey, you're the young old. It's time to start building your muscle. Okay, so I go to young old. What does it mean by young old? Young old is people above from 60 to about 69. So the middle old is 70 to 79 and old is 80 and above. So for you and I here, well done. You're young enough and you should be doing a lot of exercise, a lot of power building, strength building. So this is where you need to, other than your diet, I know everyone here eat very well. Okay, so when you eat all your protein like your fish, meat and whatnot, right, and you go and work out, must work out, not just go for a stroll in the park, not good enough, not good enough. Because as we age, we will start losing muscle mass, confirm one. But you don't want to lose so much that it will affect your function when you grow until 18. I expect everybody here to live until 86, according to national standard. So you start now. This investment, at 60, you take money from CPF, never mind. You must start investing in your own health already for the next 20 years. It will show, okay? Now, as a young old, what you want to do is also to start balance training. Okay, so for those of you who cannot withstand a MRT jerk, that means your balance is not very good. Okay, so start building your balance. Start now. When it becomes a habit of exercising, your muscles are so strong to hold you, even your nerves will not be impinged. When you exercise, there's a lot of blood circulation going on to keep your bone healthy and strong. So especially women, osteoporosis, okay, or those people who is always indoors and not exposed to the sun, it's time to get every day 15 minutes of sunlight for vitamin D. Hey, free one. Q&A got no reward, but this one I tell you, go under the sun. 15 minutes free vitamin D. It's a healthy version, easily absorbed into your body because it's manufactured in your body. So you start now, okay? Go and get your sunlight, keep your bones strong. You start now by exercising, keep your muscles intact, keep your muscles supple. Even if I tell you, if any one of us here has a stroke, if your muscles are very in tune with your nervous system, the day that you gonna have a stroke, it's easy to get back to health. It's easy to get back to health. It's easier to reconnect back after an injury or an illness or like Parkinson's or even, anything, total knee replacement, a stroke. So if your baseline is strong, if your foundation is strong, you can withstand anything. And then you will recover much, much faster. Okay? I hope that answers your question. So
Yes, thank you.
anyone in between the middle O, you just follow. You want to
I'm a
feel
young
younger, you follow the young O. Okay, good. What kind of exercise is good? Oh, what kind of exercise is good? Some say jogging no good. Okay, this is a very good question. You see, in order for us to build bones, we need to have a good amount of stress. And you need force, right? So walking is carrying your own body weight one. If you start jogging, it's about 3 times your body weight. Okay, that's bone building. Okay, if today you climb staircase, you just boom, 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 maybe like 1 to 2 times your body weight. If you go running, okay, that's about 5 times your body weight. It also depends on what surface you do lah. So for example, today if you go concrete pathway, right? It's actually not very forgiving. So people with knee pain, you may want to avoid the concrete path because it's very, very hard. In fact, if you know the tar road that we have, the black color tar road that the car drives on, right? It's actually softer. According to research, they look at the hardness of our walking surface. So like even better is those stadium, there is the red color kind of like tracks, right? And those actually absorbs our body weight. And it's even. Of course, if you cannot gain access to such a surface, right? People will say, oh, walk on grass. But in Singapore, the grass here not very safe. A lot of holes. A lot of holes. You go down, then you ankle sprain, then you come to me for ankle sprain. Maybe not. Maybe not. So another way of walking fast or even like a brisk walk will be a good one. So it's like in between without increasing your body weight by too much, but it's still bone building. Is to walk on treadmill because it's soft. It's very soft. There's actually a small little layer of air between the belt and the platform that will cushion you. And of course, your shoe is very important as well. Okay, so people say, shoe, $200, oh, so expensive. Oh, but I tell you, you only got one pair of leg. I don't know whether you want to spend $8,000 to insert a titanium or you want to spend $200 every year for a fashionable, nice shoe. Okay, so be nice to yourself. You only got one pair of leg. Don't replace it. After you replace one, gone liao. So remember, all your joint replacement once a lifetime only. No second chance. That is your second chance already. Okay. But I have to say, these are things that you can do normally. But for those of us who are more interested, you can actually find a personal trainer to introduce you to a gym. And nowadays, the gym is very friendly. If you go to any Active SG gym, there is something called her machine. You can, the screen, like the iPad like that. Then you press the button like, I need to cannot miss one. So if you know how to use the iPad, you can use those machines. But probably you need to join a class first to get used to those. Okay, I used to run classes in the gym. I think some of you here may have experienced that before. So once you get used to the equipment in the gym, right, you will know, okay, let's strengthen up the muscles around the hip. Right? So in general, I don't know whether you can see or not. Okay, so in general, the side, the front, the back, okay, all these muscles you should strengthen. It will help you with back pain, knee pain, and even ankle problem. Okay, so this is the fundamental. And then if you want to also work on your knee and your ankles also right? Exercise cannot be just one part. Even you eat chicken, also eat the whole chicken, right? Okay, I see some of you laughing. You got the idea. Okay, very good. Okay, very good. Okay, one last question.
Yeah, Shan, I have a question.
Yes, Mabel.
Okay, yes, I'm mid-old and I have gone for total hip replacement 3 years ago. Yeah, so now I'm regularly exercising using weights, using stretch bands. I have attended sessions with the her machine, and they're all very good. Yeah, it sort of strengthens my legs. Now my legs are stronger than my hands. Yeah. And my question is, there are times that when I do certain exercises, now with COVID, we cannot go down to the gym, you know. So we do online, and then the HPB has exercises online. Yeah, and after doing certain exercises, I realized that the pain comes back to the hip that I have operated on, you know. So I think this must be the exercises where I cross the middle line, is it? Or I have done less than 90 degrees.
So thank you, Mabel, for sharing her experience. Wow, nothing beats someone who has done it before, right? Oh,
Yeah.
no. You better get her number also.
It's very good. It has given me quality life. I can travel, I can climb mountains, I can ride horse and do everything, you know. Yeah, the only thing I can't do is squat and sit down on the floor and cross my legs. I can't do that, you know, fold my legs. I can't do yoga. Yeah. Yeah.
Okay. So you see, when we give our hip a second chance, it has new life, and even better quality of life. Okay. So
but some restrictions, Shan, there are some restrictions. Yeah.
So my question to Mabel is, what did your doctor say? Did your doctor say you have to continue to follow the hip precaution after 3 years?
He has already released me. My doctor has gone private. And he says, you don't need to see me anymore. So I've not seen him for a year. Already a year, yeah.
So I'm very happy that Mabel brought this point out, because a lot of times public organized exercise classes, they're assuming that you are healthy. However, you need to know your body. That's why I tell you this. You first of all need to know your condition and what your intervention means. Because this is the basic principles, right? Now, if you know that, okay, I've got a hip issue, but these exercises are meant for the general public with no problem. You know, their bones are intact, their ligaments are intact, their joint capsule is so strong. But there will be some things, right, that you cannot do. Once you listen to your body, if there is an achy pain, it's okay. Okay? It means that you're using the muscles. But if it's a stretching pain, unless you're doing a stretch, you should not feel that kind of pain. And if let's say you feel sharp pain, that's the time you stop. So listen to your body. Okay, if you think that I'm not very comfortable doing this, this is where you can consult the trainer. But you have a huge disadvantage, because in a group class, you may not gain access to the trainer.
Yeah, on Zoom. Yeah, on Zoom, so no way.
Correct. But also because most of our trainers, they have not worked with people with disability or conditions. Majority are like that. So that's one of the reasons why a lot of times, like for me, right, I will actually get a personal trainer, myself and the patient, and when they do their treatment, they do the exercise, I will say what can be done and what cannot be done. So maybe for the first time round, you can get your therapist to check, like, okay, what did the personal trainer did with you? And then you see, can or cannot.
Yeah, Chan, that's right. You know, when I did the her machine, there was somebody who was teaching me all the different machines, and the one that I can't do is abduction. Yeah, and I could only do that on my 3rd year, not the first 2 years. Yeah.
So you see, there are many different ways of doing things, right? There's no one correct way. So today, if you cannot cross midline, but that doesn't mean that you cannad strengthen your hip adductors. You know, that your inner thigh that does the action. It doesn't mean that. All right. So there's different ways of doing things. Okay. So if ever in doubt, first of all, listen to your body. Then go and ask someone who is trained in it. Okay? Cannot? No.
Thank you for your advice. Yeah. But how do you know the difference between stretch pain and achy pain?
You just feel it, lor.
I mean, pain, you know, when it is really pain, yeah, but the achy pain and the stretch pain, a little difficult to tell because the pain comes the next day. It doesn't come immediately sometimes.
Now, usually an ache comes after the session, but a stretching pain is immediate when you do the action.
Okay.
Wow, you feel it already. Okay, so that's how you tell. So, but very good. Thank you so much for the question. Okay, so because of time, okay, so this is my
Thank you.
YouTube, and there are certain some topics that you may be interested in. It actually consists of ergonomics and pressure relief and some tricks here and there to do transfers. So you can either go to this YouTube, or you can go to Golden Concepts one, whereby they recorded the previous few talks. Okay, so just some resources for all of you here lah. Okay.
Yeah. Okay. Shan, can I ask one question, please? One last one.
Vanessa cannot.
One last question regarding scoliosis.
Of course. We can stay here for many hours. No problem.
Can physiotherapy help in scoliosis? Let's say about 20 degrees, minor scoliosis.
Okay. This is a question that I get a lot of times also. You see, the thing about scoliosis, it happens twice in our lifetime. One, when we are really, really young, when we are having puberty. Second one is when we grow old, and we don't know what's the reason for it. So what happens is, around our spinal cord, our spine, there is ligament in front and at the back of our vertebrae body. What happens is one side grows longer than the other side in a different speed. So in order for, you see, one is our finger lah, right? One grow longer than the other one. And then in order to keep pace, right, I need to somehow twist my hand, my finger, so that they are similar height, or I bend the other one, right? So this is what happens to scoliosis. You rotate, the spine rotates, and then you kind of flex and lose some height. Now, there will be always curve, correct or not? Because of this, there will be curves.
Yeah.
The side that is bent will be too long. It will be weak. The side that is shorter will be too tight. So physiotherapy in general say, okay, let's strengthen the weak one and stretch out the very tight muscles.
I see.
So if you approach any scoliosis clinic, there are two different ways, right? Number one is you go for your surgery, which I tell you, when we are old and we go for surgery, there is no guarantee. I haven't seen a very successful one lah. Whatever thing you do, right, another problem will pop up, right? So you today put plate and screw, but the whole spine is stiff. Then you overuse other parts of your body and cause more wear and tear. Are you ready for that? Right. So if you don't go for surgery, then you go for non-surgical, which may involve like physiotherapy. It may also involve like wearing special garment, but it's very restrictive also lah, right? And but I have to say, if you are thinking of going to chiropractor, I suggest not, because at this age, if you can have that issue, your bone, you must think how strong is your bone? Can it withstand that torsion and that force of someone trying to align your bone back? Is your ligament strong enough to take that force without breaking or without sprain?